20 million people in the United States have asthma. For 20 million people in this country, every now and then breathing is an ordeal. And when breathing is an ordeal, life is not as it should be. The first remembrance I have in my life is my mother having a very severe asthma attack and my father trying to help her with a old-fashioned handheld nebulizer that really was not very effective. And I remember her having enormous difficulty to breathe. So even at that time, I was a 4 or 5-year-old boy, I committed myself to preventing and curing this disease. What I do mostly is epidemiology, that is large populations and trying to determine what are the risk factors for the disease so we can use those risk factors as targets for preventing the disease. We have been for a long time interested in the possibility that exposure to bacteria, protective bacteria and bacterial products in early life, very early life, could prevent asthma. One of the hypotheses we have is that we are too clean. We're not exposing children in early life to bacteria that perhaps allow their immune system to develop in the right way. So we're doing a clinical trial in which we're giving bacterial products to 6 to 18-month-old children. 400 are receiving the product and 400 are receiving placebo. We give them that to them for 2 years and then we follow them for another 3 years. It's a very long, very difficult, but I hope in the end very rewarding trial, because what we're expecting is that with these bacterial products we're going to prevent asthma in some of these children. There are two things that continue to inspire me. The first one are my patients. They describe what they feel when they can't breathe. Think you're breathing all the time through a straw. I mean, it's difficult because you can't get air into your lungs and you become anguished and try harder, and the harder you try, the worse it is. The second thing is that science is 90% frustration and 10% elation. And I live for those 10% moments in which you find new and exciting things. You put that small little brick to the building of knowledge, you feel that you have done something that is important, not only for our team, but also for those that we're trying to affect with what we do.